Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today's guest is Ryan Day. He's president at HST, a multi-plan company. Welcome, Ryan.
John, appreciate you having us. We're looking forward to the conversation.
Yeah. So, for those that aren't familiar with HST, tell us a little bit about yourself and HST.
Yeah, so Ryan Day, co-founder of HST. Gosh, we were founded back in 2009, and one of the reasons for us founding it is just trying to figure out healthcare, right? So we wanted to right a social wrong. So if you looked at some of the metrics, like 62% of household bankruptcies due to medical expenses, like
So sad.
oof, that's a tough one. It really is. And then I had an employee come to me recently and say, "Hey, I need to tap into my 401k because I need to go pay my mother's medical expenses." Like, and it's mind-boggling. So here we are today. You fast forward to where HST is now. We were acquired by MultiPlan in 2020 of November 2020. And now you look at it, we're up to almost 1 million members on our platform, using transparency and quality and everything that goes with that, and just a different way to approach healthcare and how you operate and deal with the employees and the members, but then how else you are working with the hospitals in kind of unison partnership. So
Yeah. Well, if you figure out healthcare, I think that would be, we'd all appreciate that. It's so complex, right? I think that's the challenge. But I think, it seems like you have figured out some of the challenges we face. So let's talk about that. Like, how are many of the current plans really failing employers?
yeah, I think about it, like if you looked at it like the past 20 or 30 years, we've done the traditional models and hey, we don't know what you're paying for, but here it is, you got a good discount, and that type of relationship. But now people are starting to understand like, wow, this is a really big expense for us, both on the employer side, but also on the member side. Well, what am I
Yeah,
paying for? Like, I mean, it's you and I think that's a simple question, like, what are we paying for? And we do it on every item we buy except healthcare. It's like, just
that's
trust
true.
us, right? Like nobody asked the price. And it's evident. Like if you looked at 2020, it was funny, like healthcare utilization was way down. Like, yes, you had COVID happening, but all your elective procedures had went away because people were dealing with COVID. However, with that said, healthcare still trended at 6.5% increase. So inflation, like so, and that always outpaces just normal inflation. It's interesting how healthcare goes in one direction, but even when you look at it, I think like 90% of all medical decisions are made without knowing the price. It's mind-boggling. So I think that's why
Yeah.
we're here, right? That's why it continues to go.
Yeah, I mean, you describe the problem so well that so many employers face, and I think they're trying to figure out, how do they move to value? I mean, we hear about value all the time. How do you really empower these employers to move to a value driven health plan rather than what they've been doing forever?
Yeah, I think you've got to engage all parties, right? So it's taking a look at what you do today, and then how can we change it? How can we buy healthcare differently? And so, those are the tools that we're bringing to the table, whether it's from the provider, the plan, and the member engagement. We're bringing the value driven health plan, like what that is allowing us to do. One, we've got to bring the transparency that everybody talks about. We've got the quality, but then you've got to be able to deliver this up through the technology, all while holding people accountable. So who's accepting a reference price, what's the quality, how good are they at what they do, and making sure that people are making decisions ahead of time for their care. And so when you show this to plans, obviously being able to make this as seamless as possible is a critical component. So having the tools and resources, having multi-plans integration with their provider networks gives us an advantage. Having reports that can show folks like, hey, here's what's going on, like giving them the data. Believe it or not, a lot of folks don't have access to their own data. Like they have the data,
Crazy.
but it's cut down in a way where you can't really, it's hard to discern. Whereas like we have the actual claims data so we can show you. So we like to be transparent. That's kind of our theme.
Yeah, it seems like it. And I think that's the problem for many of the ones I talk to is it's kind of fear of the unknown and fear of doing something different because maybe different's worse, right? So is that the key to overcoming that fear with these employers is showing them the data?
Yeah, no, absolutely. I think that's a really good, like that fear, like it's change. You're going to have some disruption. Like, how
Yeah.
does this all work? So I think a lot of times what we do is like, hey, we know the savings is there. Here's the savings, and we do that. But taking it a step further and having the eyes wide open discussion, well, like, let's look at the facilities you're utilizing. Say it's your top 100, and let's overlay what our experience is. Are they accepting 99% of the time, 67? What is it? So that way we're making decisions ahead of time, and it kind of takes that fear out of it. But it's going in, you got to be able to present that information to the employer. Absolutely.
Well, it's good that you have a lot of experience with this now, right? When you were starting, you were guessing, I guess,
No,
and
true. Like
hoping, right?
when you were starting, it's like, gosh, I hope it works. But now with having the data and updating, like, yeah, absolutely, it makes all the difference.
Yeah. So explain, how does a value-driven health plan really work?
Yeah, so I think that's a really good question. I think when you look at healthcare traditionally under a traditional arrangement such as a PPO, we look at it as from almost like a top-down approach. You've got billed charges that start at the top, and then you get a discount, and then the plan pays from there, the allowed amount. What we're talking about is like, well, let's look at it a little bit differently. Let's maybe start at the bottom. Let's look at what Medicare would pay for the same service at that facility, and let's see what it costs the facility. And then let's tack on a percentage. So a lot of times, let's say 40% or 140% of Medicare, and then that sets the reimbursement. So you're now setting the reimbursement saying, as a self-funded plan, here's what I'm willing to pay for those services, like an MRI, based on those parameters. So we call that the bottom-up approach. And so it really is like almost like your traditional plans, in the sense that you can have a PPO network for the physician and ancillary, and then on the facility, it's on the Medicare Plus. Others are like, hey, I want to do Medicare Plus for everybody, all like physicians and ancillary facilities. Okay, roger that. We get it. So there's different ways to divvy it up, buy it. But from the standpoint of a member, they've got a logo on their ID card. They hand it to their doctor, business as usual. And then you've also got where you provide that same thing to a facility. Yeah, now you can have questions, and people are like, what is this? I don't recognize it. And that's where you got to be able to step in and help not only the member, but have that conversation with the facility too, or the provider.
Gotcha. So, I mean, when I look at this, it makes sense, right? You're paying less for the same services, right? That feels like real savings. But are we just shifting around the statistics here, or give us a feel like, what can an employer really save, using a value-based plan?
Yeah, and that's a really good question. Like, are we just paying for another service where it just shifts it around, like, or am I
Yeah.
actually affecting something? And when you look at it, if we walked into most employers today and we said, hey, if I can save you, 20 to 30% off your medical spend currently, are you interested? Here's why. And so, you don't have to believe, anything that we say or what we're doing. You can ask the employers that are doing it. But more importantly, a lot of self-funded groups will utilize stop loss carriers. So, in that instance, it's, they'll take risk on certain claims, but anything above stop loss is going to pick up.
Mhm.
Those are the guys who are putting pen to paper to say, okay, you were previously using this type of arrangement, traditional, and now you're using an HST arrangement, or an RBP arrangement, excuse me. You're going to see about a 20 to 30% differential in your premium. That's fact. Like,
Yeah.
that's not fiction. So that's when it becomes really real. And when you look at some of our groups loss ratios, this is also what comes into play. I mean, we're running at a loss ratio between, I'd say, like 45 to like 55%. So when a traditional plan on a good day is running at like 80% loss ratio. So this is like, it's more of that here to stay, not a flash in the pan.
Yeah. Well, it's interesting too. You talk about the importance of transparency. I think as an employer, most employers like that. As
True.
a patient, we like it, right? Because we've been so much in the dark. How does that play also with the provider organizations, and how do they react to it? And what's been the response to this approach to transparency, and what role does it play in the move to value?
Yeah, I think it's what we've seen with the providers is that there's been a few camps. Ones that are like, hey, it's fee for service. We're just going to keep going down this route. Others are like, hey, no, we get it. We gotta change. We got to do something differently. So what we like to do is just break down the walls and the barriers. Traditional models usually keep the employer and the provider from talking. Like, they can't talk to each other. Like, they just keep them in two silos, and we'll handle everything. What we're doing is like, hey, you know what? Why don't we connect everybody? Why don't we connect the employer to the facility and let's have conversations. Because a lot of times from the provider side, you have an employer who makes a decision, doesn't really consult, the provider. And what I mean by decision is, hey, I'm going to put a $5,000 deductible. I hope that
Mhm.
works out for you and you can go collect all that. And a hospital's like, oh, great. Now I've got to write this off.
Yep.
And then from a member's perspective, well, maybe I'm not going to get services rendered at that point. So transparency's, a good thing is how you embrace it and how you provide the tools for both. So if I'm providing the tools for one set on the employer side saying, hey, here's what you're paying for, here's what you're getting. But then on the provider side, giving them the same tools like, hey, do you want to look up pricing? Do you want to see how you're going to get paid? We're just trying to make it simple, stupid. And I really think healthcare is like that, but people have overcomplicated it. I don't know if it's for job security or what have you, but it's really simple to kind of get everybody together and say, we've got to figure this out. Because if we don't, obviously the government's sitting there waiting to step in to say, hey, we'll figure this out for everybody. So it's just an unsustainable. So the more we can work together, I think the better off it's going to be. And then you've got the transparency law, obviously pushing that a
Sure.
little bit more.
Yeah, absolutely. I mean, I think the transparency is going to become a bigger and bigger topic if we don't address it, as you say, the government's going to hop in, and it's complex enough for patients. I kind of, I hear this and it sounds great, right? I mean, who wouldn't want to pay less for healthcare, right? Everyone says healthcare costs too much. Let's fix
True.
that. But what's the experience like for a patient? I mean, do they have to shop around? I mean, do they, what's the experience for the patients in these types of plans?
Yeah, no, yeah, I think that's a great question. I think, yes, they have the ability to do more shopping, but we all know from a member's perspective, it's just like, I don't care about healthcare until I have to use it.
Yeah,
Right. And then,
exactly.
then they start to pay attention. And so I think you're starting to see definitely in the reference-based pricing space where traditionally you have an ID card, you've got all these numbers on there and like, who do you call? What do you do? And all these websites and tools and apps and everything you could possibly want, where a lot of folks are starting to consolidate it to one number. And they've got one app where you can see all that information. So if you never want to talk to somebody and you want to roll through the mobile app or the website, you have that ability. Or if you want to talk to somebody, then you've got one point of contact, like almost like a concierge who's going to kind of guide you through that process. Like, oh, I don't know who to look up doctors, or I don't, well, great, I can do that for you. Right. And
Yeah.
you kind of have that ability. So the patient experience we see has been evolving in an RBP. When it started, like, oh, it's just like every other plan. And I think that's definitely worked. But then as people get more sophisticated and they're looking for a better member experience, they've got the savings. But how do I make that member experience? How do I take it to the next level? We're seeing a lot more folks kind of add in that concierge where it's that white glove service where it's very hand holding for the members. And that's been a huge value. Like, definitely, I know under our previous, arrangements when we had healthcare, it was like I said, there was like 10 different numbers on the card, who to call. It's like, this is confusing. And then if you try to ask like, well, what's the price? What am I going to pay? Everybody's like, I'll get back to you. And then like 4 days later, you're like, well, I already had the service. So thank you. So
Not a great experience, right?
yeah, that's right. Exactly.
Well, and it probably the employer benefits as well from that type of concierge service that ensures that they're going to the right provider that might be not necessarily even the lowest cost, but the highest value
Mhm.
from a quality perspective. So, how do you approach that in ensuring patients are really going to the highest quality providers?
Yeah, so you've got to be able to marry the tools, right? And so I kind of hit upon it a little earlier, whether it's the provider, the plan, and the member. We have those tools where a concierge is looking in to say, okay, not only we can see, hey, 99% of the time they're accepting this type of reimbursement, but what type of quality do they have? Is it a one-star hospital? Is it a five-star hospital? And they can start engaging that way to start to gear members based on not only price but quality. But at the end of the day, it's always the member's decision on where they want to get healthcare rendered. But if you're making more eyes wide open decision, then it makes a lot more sense. And like, it's a perfect thing that we saw recently not recently, I would say past few years. California did a study and it was showing the higher the price, the worse the quality. But I think we've always been
Interesting.
geared as consumers. Ooh, the higher the price, it's got to be better. It has to be.
Yeah.
Not that doesn't hold water in the healthcare world. So interesting that way.
No, it is fascinating. And I've always said that, right? I mean, you look at ratings and review sites, they can only rate the customer service. They can't rate the quality of the provider, because you and I as consumers don't know. And yet the number one thing we want as a patient is the highest quality provider, which is hard to do. So it's great that you're kind of providing some of that service.
And it's like, if all of a sudden you were going to go get a knee procedure and the doctor you were looking at, and today you don't know, like let's say he had 8 malpractice suits that he's had to pay out, you would probably think a lot differently on who you're choosing.
Yeah, you would.
But it's not public, right? So like, how are we as consumers, like that's information we should know, right? Like, it's our bodies. We're trying to figure this out. Like, I want to get the best care, because you think about it, and I always go back to the story, like, let's say you're having a knee procedure. Oh, this is the Dr. Tiger who did Tiger Woods' knees. So then everybody's like, oh yes, I need to go use him. But that's how you're basing your quality on it. Like, so it's just stuff like that.
Well, that's the problem. I mean, it goes back to your transparency argument, right? Is that we don't have the information we need, so we grab on to whatever we can find. And I think that's one of the challenges in healthcare.
Yeah, no, I agree. That's a great statement. I mean, for you, like, do you see the same thing when you're shopping for healthcare? Or is it just convoluted, confusing? I mean, you're a consumer just like I am. Like, you tell me your experience.
Yeah, well, and I actually describe this often because working in healthcare, I have a lot of physician friends, and the best healthcare I get is when I text my friend. And it's like, why is that such a better experience? It's because that person actually cares about me and wants to improve my care. And so they essentially navigate that challenging system for me in many regards, right? Thankfully, I haven't had anything major. And so maybe that's the key there. But yeah, I mean, I think, it's like, how do you take that personal experience that I get? I know I'm in a very privileged position with a lot of physician friends. How do you do that at scale? I think that's a challenge.
Yeah, no, and I think that's a great point. Like, how do you, and you really hit upon it. How do you do it where you're not just trying to jam patients in? You're really trying to improve their care, like really taking the time. But to your point, like, I mean, sometimes people can call that a pipe dream to be able to do that. Like, because we're getting beat up on payments, and we've got to jam all these members in, and here's why. And I'm not really paying attention to, really taking that handhold quality time with that member. So I think that's why you're starting to see what the concierge doctors come up, and that's a whole nother ball game and discussion for another day. But I think there's some people trying to figure that out.
Yeah. Well, there's a lot to work out here, but it seems like you've approached it from a pretty unique perspective in a way that can provide a lot of value to employers. We know that employers are suffering through this. Just look at some of the big efforts from Amazon, Chase, et cetera, that are trying to address this problem. So it's great that you're working to help employers. So where can people go to learn more about HST?
Yeah, if they want to, we've always got the home front of the website, hstechnology.com, or you can email us at info@hstechnology.com. That's probably the best way to get some more information.
Awesome. Thanks so much for sharing your insights and perspective on this, Ryan. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Ryan.
John, appreciate you having us.